Over at Perth Zoo, Dr. Peter Ritchie's day is already off to a busy start.
Our day-to-day work here mainly involves wildlife animals to keep healthy animals healthy. So who have we got here, Steve?
This is little Alia, one of the orphan quokkas that came to us from Rottnest Island a few years ago.
I love the zoo because it is a magical place. The work that is done here saves wildlife. Pretty excited to see Azuri.
After his morning rounds, Peter's next patient is one of the zoo's latest additions.
Azuri has come to us from another zoo. She's here to start our breeding program. These guys are vulnerable in the wild, and it's really important that she breeds to contribute to the preservation of this species. The main reason Azuri has come into the clinic today is because she has an implant in her that is suppressing her sex hormones and stopping her from being able to breed. So we're going to remove her implant. This will allow her to breed with males when we bring them to Perth Zoo.
Azuri has returned to her sleeping quarters, giving zoo vets the opportunity to anaesthetise her ahead of the operation.
The most dangerous part with her anaesthetic procedure is when she's been darted and we're transporting her.
Big cats are at risk of dying suddenly while under anaesthesia, so the team must work quickly.
It's definitely a very big deal moving a 180-kilogram cat. It requires 8 people to carry her. She is a bit of a dead weight when she's asleep and anaesthetised, so that's 180 kilos that we're having to manoeuvre from her exhibit into a van and into our veterinary hospital.
3, 2, 1, left.
It's an intense moment when we've got all those people in close proximity to a potentially lethal animal.
Just watch your noggin.
With Azuri the lioness now unconscious, she's transported to the Perth Zoo clinic, where Peter and senior vet Simone are ready to take over.
A bit nervous at the moment. We want to get things happening very quickly. Big cats hold risk under anaesthesia, and the longer she's under, the bigger the risks.
That's it. Just watch your head, guys.
Ready? Okay. Okay, poles on the end of the van.
It's going to be our only chance to get our hands on her and get up close and personal.
Right, shall we start having a look at a few things,
Sure.
Pete?
Do you want to get catheter in? Or...
I'm going to clip that right now.
The team needs to remove Azuri's contraceptive implants without delay. With every minute critical, everyone is under pressure.
Now we've got her on the table, we're going to start our procedures. We've got to work quickly. It is dangerous for her to be under anaesthetic for too long.
Can we just move back a touch, guys? Yeah.
Azuri must be intubated to monitor and control her breathing during surgery.
Down a bit though, guys, because I'm 4 foot. Oh, God.
I thought you wanted to use the smaller one.
That's in.
I'm happy that's in.
The team must now perform an examination and vital tests before they can begin surgery.
How much do you need?
Only 3 mils, but I'm going to get 5. It's a known risk that potassium levels will rise and spike in big cats when they're under anaesthetic. This is a really bad thing if it happens because it will mean that Azuri will suffer from a cardiac arrest.
What do you reckon, Pete? Have a look.
Doing a dental exam on a big cat is one of my favourite things. Their teeth are just incredible. Just see the damage that they could do to you, to an animal, that they're prey, and there's just so much power in those muscles in that jaw.
Beautiful young feet, and feel how tough those pads are.
And she is very young looking, isn't she?
Oh, I know.
We'll have a check over her whole body, looking for any lumps and bumps. A general physical exam is vital at this point to ensure she doesn't have any health issues. I'm looking at her ears. It's all looking really good at the moment. There's nothing I need to clean out, so we'll leave that at that.
The last blood sample is taken and Azuri's physical examination is complete.
Shall I be your nursey?
Just doing a surgical scrub before we surgically remove the implants in Azuri's legs. I'm going to be sterile with this procedure so we don't introduce any infection.
If the contraceptive implants can be safely removed, Azuri will be able to join the breeding program at the zoo.
implant there underneath her skin, so literally see it and feel it there. And we'll just be making an incision around that and removing that completely.
We're about to start surgery.
I'm cutting, yep, first incision. It's incredibly tough. It's much, much tougher than a domestic cat. These guys are obviously designed to withstand other lions and hyenas biting and scratching and those sorts of things, so their skin is very different when we're suturing it, placing catheters, giving injections, and you have to have a bit more elbow grease, I think, in there.
It's Peter's job to locate and remove the implants that have been preventing Azuri from conceiving.
The implant is rather tiny. It's only a couple centimetres long. There are 2 of them, and they kind of look like a little bit of candy.
Just hold on to it. Yeah, that's it. There are 2.
I think there's one on top of the other one.
Oh, okay. Lovely. And I'm going to steal a swab and get you to give that to me, and then I'll have a look at how much we've got there. All right.
The implant's out completely, which is good. I've just got to do my skin sutures now, and that'll be it. We're going to have to wake Azuri up quickly. For her own safety, we want to get a move on and get her back into her enclosure and get her awake from anaesthetic. We've done everything that we're going to be able to do with her now.
Until the lioness has been successfully woken, everyone is still on edge.
So I'll take her off the machine and then we can come out.
At the Perth Zoo, Lioness Azuri is returning to her pen after surgery to remove birth control implants.
It's been an incredible day. It's an amazing experience to get up and close and personal with a critter like Azuri, and we'll await some results from our tests, but all in all, Azuri's passed with flying colours with her medical exam, and I've definitely had a pretty exciting day at work. They're going to pull the stretcher backwards. Yeah.
That's lovely. That's
there
a
we
great
go. Yeah. She's now waking up, and we're giving her drugs to reverse some of her anaesthetic medications that are going to make her become conscious very quickly, so this is a very risky time.
Oh, Azuri, there's an eye. Hello. Oh, there we go. That's a real blink.
So she's just started to recover. She's staring, she's moving her head. Her eyes have come back to normal, and she's looking good, and most dangerous bit's over now. Azuri previously had an implant in to prevent her from breeding at too young of an age. Now that it's been removed, she's going to be paired with an appropriate male and hopefully has some little lion cubs.
Hi, I'm Dr. Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.